Hello, and welcome back to another Thursday with Trucker Talk Thursday with your host, Marsha Withers with Extraordinary Logistics Solution. I am so glad that you are able to join us tonight. Thank you. Please take time to share. We have some important subject matters that we're going to cover tonight that is going to help everybody. It's not just only for truck drivers, but for African American males, Caucasian males, all male gender, right? So take a moment, hit the share button, like the post, like the video, and post your comments, your suggestions about other topics that we can do for you here at Trucker Talk Thursday. We look forward to working with you and partner with you as we continue our broadcast. All right, so guess what? This month is National Truckers Appreciation. So let's take our time and a minute to say hello and thank you to our commercial drivers. We really do appreciate you. It is a pleasure to work with you here at Extraordinary Logistics Solutions. We don't take it by chance that you have decided to partner here with us as letting us be part of your dispatching agents here at XLS. I've been doing this business for a while, and I must say, some of my clients I don't even know. I have not even met face to face. That's kind of interesting, isn't it? For you to have such a personal relationship with somebody and never had the opportunity to meet them face to face. So I would like to say thank you all for trusting Extraordinary Logistics Solutions to be your dispatch agent. We do not take our positions with your company lightly. We strive to make sure that you have everything you need to conduct your business the way it needs to be conducted. So I would like to say thank you, thank you for trusting us with your business. All right. And being a dispatch agent as well as operating trucks, having your own trucks and operating your trucks is quite interesting because there's so many things that take place on a day-to-day basis. Of course, you are a truck driver, you know what you face, you know what you need, you know that you're not spending as much time with your family the way that you want to, but you're still doing something that you love to do. Having the capability to travel across the country, seeing various sites. There's so many things that you all have seen on the road. And the way that everything is going on with our economy, you still decide to keep going, keep pressing, keep pushing. And so I say thank you. Thank you for taking the freight from one destination to the next destination. We really do appreciate you. As a little girl, my father was a truck driver as well. That's how I probably got started in this business. And riding with my dad, it was fun. You have the kids in the car was one of those that say toot your horn, right? And you get on the CB when your dad, well, my dad was in the car, get on this in the truck, get on the CB and say breaker 19, talking to fellow drivers. And my dad's handle was Evil Knievel. So when my dad was going down the highway, you could hear the other truckers call his name, talking about Evil, what's going on out there, you know. And the reason why he got his name is because my father had so many accidents and he lived to see another day. And so from that point, he started, they gave him his handle, Evil Knievel. So here it is, several years later, I am in this position and I never thought that I would be here in this magnitude and have the visions that I have for commercial drivers, for the trucking industry, and the things that I would like to do. It is such a privilege to be here in this seat and just to say thank you. All right. Well, next we have on our agenda, it is wrapping up the end of a third quarter. And there are some of you that are planning your next business strategy for the next year. And some of you do it on a quarterly basis, and some of you mark out, the next year or so of how you want to implement these changes in your business structure. And right now, we have a couple more weeks, 15 days before is your IFTA is due. And if you need assistance completing your IFTA, please let us know so that we can come out and, well, not come out because we're going to do this over the phone, but we can assist you in taking care of your IFTA taxes if you don't have no one completing those for you. You can reach out to us at 800 404 2554, extension 703, and someone will be able to help you. All right. So, the topic of discussion for today. Whoop, whoop, whoop. All right. So, I'm doing my own broadcast. So, bear with me, you all, as we continue with the next. So, over the last few years, I have been doing some research and some studying regarding prostate cancer. And it's not an easy subject to talk about, but it's a subject that we have to talk about because most of our truck drivers are male, and most of them are not really aware of the ramifications as part of being a truck driver when it comes to prostate cancer and how it affects your life. You may say, well, Marcia, you're a female. Why are you talking about prostate cancer? Well, guess what? I have a son. I have majority of my drivers are male drivers. And it's something that we need to take seriously and bring awareness to. I have a video that I'm going to share with you, and it's from Zero Cancer. And it's a company, a nonprofit organization that's based in the Virginia area, and they have a platform where they're really promoting the awareness for prostate cancer. And I'm going to play this video. And after I play the video, we're going to come back and we're going to add to this discussion. All right. Well, when you get some time, please go and check out this this website. I recommend that all of our male counterparts, drivers, as well as just friends and family, take a moment to get checked out. You never know how serious this is, and like the gentleman said in the video, how they check you is uncomfortable, but it's something that has to be done. And in order for you to really find out what's going on with you, here are some symptoms for you to think about. And if you are experiencing any of these symptoms, please see your family physician. Now, look, I'm going to put out this disclaimer: I am not a medical physician, okay? Since I'm not one, then I recommend that you see one. This is National Prostate Cancer Awareness Month. And I'm bringing this to you because it is so important to me. Because a CDL driver sits behind the wheel 14 hours out of a day, sometimes longer than that, you don't have the plush leather seats like that you may have in your car. You don't have the shock support that you have in your car. And it presents a problem with the vibration in the seats as you're driving down the road. And because of that, it causes the aggressiveness and the vibration with because of you're sitting down. The vibration causes the movements to rapidly speed up the stages of prostate cancer. So this is why I'm bringing this to you. My goal is to have a prostate cancer survivor on for next week, that you're able to have live discussions and live to speak to live on our broadcast and to ask questions regarding that process for them as they for him as he has gone from the beginning to the ending of this stage. So one of the things, a few things to take in consideration when you're looking at if you have prostate cancers, here's some of the symptoms: trouble urinating, frequent urination, decreased force in urination, difficult starting or stopping a stream, blood and semen, painful discomfort in the pelvic area, and bone pain. Now, there are different methods of treatment that can be done um, as far as depending on what stages you are in this process. And let me just tell you, as much as we don't like to go to the doctor, and I'm speaking for our African American truck drivers, our African American men, I am pleading with you to take the time to go out and get checked out. Make an appointment when you go back home to your home base and see your family physician, because it's nothing like finding out that you could have prevented something ahead of time if you were aware. So we're bringing awareness to you. So the Bible says, my people perish because of lack of knowledge. Well, guess what? If you don't have the knowledge, you don't have the intel, then you can't move forward. As I search over the internet, I'm looking through different videos, Facebook, well, not necessarily it's too much on Facebook, but on other social media outlets, they're not really talking about prostate cancer awareness for the commercial driver. Some publications were posted several years ago, but it's not something that is repeating itself every day. You know how when the media, social media, or just media in general want you to really take in something in your mind, they play it over and over and over and over again. to make you more aware of what's going on or to change your mind about a subject matter. Think about this. Breast cancer awareness is so big. The pink flag is so big because they promote it and they push breast awareness for women. Women coming together and pushing the issues, of how they felt, or having a mastectomy caused them to feel a certain way. So there's all this push for the women, but what about our men? You're just as important as our women. Without you, we have no children because you have the seed, right? We may have the womb, but you have the seed and you have the beginning stages of life. Isn't that important? So why come we don't hear more push about prostate cancer awareness? Think about this. Your life is so important because you give life. And so even though you're more the dominant factor, right? But you're still an important factor. So I plead with you to go out and get this done. It's nothing like um, going through cancer alone and going through anything alone. And sometimes we have so many big plans, and then all of a sudden we have this stigma, this elephant in the room called cancer that we can prevent. We can take medications, get radiation, have different types of therapy and services, right? But if you don't know, how can you prevent it? Also, think about the healthy eating behaviors as you're over the road, picking up some things that are just not as healthy for your body, getting the proper nutrition, the proper vitamins that you need, especially as you get older. When we're younger, we have so many um, nutrition factors our in reserves, right? And as you get older, sometimes those reserves are depleted because now your body is taking in those reserves because our lifestyle has changed, our eating habits have changed, life around us just have changed. Now it's time for us to pour back into our body, and it's so important as you get older that we're implementing the changes in our lives. We're implementing more multivitamins. We're implementing the vitamin D. Uh, for most African American people, we don't have enough vitamin D. Even though you are a commercial driver and you're driving and you're in the sun, but guess what? Only part of your body is in the sun, and that may be just your right arm because your right arm is sitting out the window as you're driving. And so that side of the body is absorbing more sun, but what about the rest of your body? Taking vitamins, drinking plenty of water, hydration is also important. Um, Drinking Pedialyte every now and then to make sure you have the electrolytes in your body that you need. As we continue with our health awareness topic, like I said, do your homework, do your research, and please see your family physicians. Now, for my wives out there, for my sisters that are out there, for my mothers that are out there, that or even friends, if you know someone, a male, African American, it doesn't matter what nationality that they are. If you know a male commercial truck driver, they could be local drivers, over the road drivers, have that conversation with them. It's not easy, or it can be easy. It just depends on who the individual is. Just say, hey, look, I just need to have this conversation with you. Have you thought about this? Are you aware of this? What are your thoughts on this? Because with that language, what is your thoughts on this subject matter? It brings them into providing an answer. It brings them into the conversation and not in a way that you're trying to get in their body. You know what I'm saying? But it is inviting them in to understand the awareness of what it is. Sometimes it is generational issues, and then you just happen to be a commercial driver, and you happen to have, more, you're more subject to it because of the field that you're in. But it's not to say that it doesn't happen in any other field. But for this subject matter, we're talking about commercial drivers. So please take the time, call them up, say, hey, look, listen to this program or watch this YouTube video, contact whomever you need to contact in order to make sure that you are physically healthy. Now, I'm not married, and this is so funny because one of my clients, we've gone through so much together. I felt like I was married, right? Because of everything that we've gone through together. And, the late night phone calls, the um, booking loads, having access because I did his whole back office to his company and just having these conversations. And then you have to have, okay, well, you know what? Have you thought about this? It was interesting, but we have to do it. As women, we have to do it. We have to do it to our sons. We have to inform our sons. When your son get to a certain age, it's just normal for them to get it done. And sometimes they don't get it done because they feel uncomfortable or discomfort or because of stories that they've heard from other people. At the end of the day, it has to be done. Get checked out. I love you all. I care so much about your health. And I just hope that you take these words very seriously. African American males are twice the risk than Caucasian males. Twice the risk. Take the time and get checked out. All right. So we are going to come back next week. Like I said, I am looking forward to having a guest speak with you all live on the show so that you can ask questions, the challenging questions that, he has gone through during this transition process. This month, they're doing a big campaign in the Washington, D.C. area. They have a run that they do. If you want to support or to pour in, you can always give them a call, zerocancer.org. Look, I'm not affiliated with this organization. I just seen their information on as I was searching. I seen their information on the web, looked at some of their videos. Very resourceful company to plug into. All right, you all. I thank you for spending this time with me. I look forward for spending next week with you. And next month is Alzheimer's awareness. And so I have I should say, I am doing that month is dedicated to my dad for Alzheimer's awareness. So I'm spending the month of October talking about Alzheimer's awareness and at the same time honoring my dad who happened to transition um, with Alzheimer's. And so as we go through that, I'll be able to answer some questions that some of you all may have regarding Alzheimer's. to the best of my ability. And I will have a special guest on as well to also give you the medical background on Alzheimer's and some pointers and tips that you can use to help you push through those that time. All right. Well, I appreciate you all for spending the time with me. Share, share, share this video. And I love you all. Have a fantastic night. Bye.